All right, so good evening, everyone. On behalf of Social Services Agency, our agency director, Bruce Wagstaff, the Department of Benefit and Employment Services Director, Denise Boland, and myself, I would like to welcome everyone to today's presentation on healthcare coverage. So with that, I would like to get started. So Medi-Cal. Medi-Cal has many different programs underneath it, and there are many eligibility criteria that are required for it, as well as an income limit. So I do have a lot of brochures and flyers on the table over there that you can take a look. There's an actual Medi-Cal information document which will list the programs that are under Medi-Cal. So that will kind of give you a good idea of the different programs that we have. It'll kind of give you a sense of what type of coverage you can receive. However, I would always suggest that the best thing to do is definitely contact our office, Social Services Agency, because then you can speak with an expert eligibility staff worker who can help you through the entire process of not only Medi-Cal, but also applying for health coverage through Cover California. Okay? So just, again, speaking about Medi-Cal, it is available for individuals and families, and not for businesses. And you'll see the reason why here. So if you're an individual who's under the age of 21, you would be possibly eligible for Medi-Cal. If you're an individual who's 65 and older, you also can possibly be eligible for Medi-Cal. Of course, you have to meet the other requirements that there are. And the reason I'm mentioning those populations is because right now, 21 through 64, under our current Medi-Cal regulations, would not be eligible. However, if you're 21 through 64 but you are disabled, then there is a possibility that you could be eligible for Medi-Cal. So again, with that 21 through 64, I'm harping on this because that's what the Affordable Care Act is doing. It is expanding Medi-Cal and it's bringing in this population that previously wasn't able to receive healthcare coverage. So as it's mentioned on the slide there, you can see expanded Medi-Cal. The income level is at or below 138% of the federal poverty level. And that part of Medi-Cal, the expanded portion, will start in January of 2014. That does not mean that you can't apply now. You can absolutely today call our offices and apply for Medi-Cal, and the expanded Medi-Cal, I should say, that will start January 1st of 2014. Now moving on to Cover California. So Cover California is the exchange marketplace. Okay, this was created because of the Affordable Care Act, and it's strictly for California. The other states have their own marketplace, and they call it something different. But speaking strictly of California, it's known as Cover California. And a good way to think about it, when you think of a marketplace, is like when you go to the grocery store, or supermarket. Okay, there's a lot of products in there, and there's a lot of many different companies that offer similar products. In the same way, with Cover California, they have health plans, and there's many different options that are available to you. So the best thing to remember with this is that you have the choice. You are the one who's in control. However, we do have eligibility staff who's able to guide you through the process, which is very important, because if you get very convoluted and confusing and there's charts and graphs, and I mean, it can be very overwhelming for an individual or for a family trying to find out, what they qualify for. So that's why it's important to contact us, because then we can help you through that process. Now, Cover California has options for individuals, families, as well as small businesses. For the small businesses, these could be individuals maybe who are self-employed and they have a small number of employees. They're able to apply for coverage for their job and for their work for their employees through Cover California. Social services on that aspect does not assist with the small businesses. You would have to go directly through Cover California. However, we do assist with individuals and for families who are looking to receive healthcare coverage through Cover California. The income level is above 138 of the federal poverty level, and there are subsidies that are available for income that is between the 139% and the 400%. Again, there are other criteria when you apply, and again, we are available for you to assist you through the entire process so that you can see what plan is best for you. Something you could do right now, if you're not sure, you just want to get an idea, a general idea of what you may qualify for, you can go directly to coveredca.com. And when you go there, you can go to a shop and compare, and it allows you to enter your information, your household size, I believe your age, and then your income, and then you submit the information and it'll give you a general idea of maybe the types of plans that you qualify for, or maybe it'll let you know that you're actually eligible for the expanded Medi-Cal when you want to contact our offices. Again, we are available. There are agents for Cover California. They have a phone number that you can call to speak with Cover California eligibility staff, or you can do it through the county if you feel more comfortable. But there's many options and many ways. So still speaking about Cover California is the 4 basic levels of coverage. You've probably been hearing a lot about the metal tiers as they refer to it in the news. So there's the platinum, there's the gold, there's the silver, and there's the bronze. And correlating to that is the paid by plan percentages, which is 90, 80, 70, 60, respectively. So you shouldn't get really bogged down on those specific details because, again, it can get a little confusing. One way to look at it is an individual who goes for, like, if you're eligible for the platinum, or you choose, I should say, you choose to go with the platinum plan. What it means is that higher tier has a higher percentage of healthcare expenses that are paid by the health plan. You yourself would have a higher monthly premium for the health plan, but in return, you would have lower out-of-pocket expenses. Okay? And they pretty much correlate like that. But to get your specific situation, because everyone is different, you need to contact our office so that we can guide you through the process. Once we have your full information, we're able to give you specifically what plans apply to you, and then you still get to make the choice. The only reason we're there is we're able to help you compare and explain to you what things mean. Because again, like I said, it can get very confusing if you're trying to do it on your own. Key dates. So this is very important because these are the time frames in which you can apply for healthcare coverage through Cover California. So they have an open enrollment period. And the open enrollment period is October 2013 through March 31st of 2014. This initial 6 months is because the Affordable Care Act is being implemented right now. It just started. It's a historic milestone for the nation. So that's the reason why it's 6 months. The subsequent years after this, the open enrollment period will only be from October through December. So starting in 2014, for example, the open enrollment period will be October through December for 2015. Okay? So I wanted to mention, though, you can apply today, as I stated, but your coverage under the health plan that you choose through Cover California does not begin until January 1st of 2014. The important date to also remember is December 15th of 2013. This is the last day to apply for coverage as well as select a plan and then enroll in that plan. Now, December 15th is a Sunday, so December 14th technically would be the last date that you can contact and actually speak to someone. So December 15th, if you're on your own online, you're okay. But if it's the 14th, which is a Saturday, we are open. Social Services Agency is open. Cover California is open. You can call, speak with someone, and they can guide you through the entire process. So the December 15th, though, I want to mention does not mean that you can't apply on the 16th for healthcare coverage. It only means that if you want coverage starting on January 1st, then you need to do it before December 15th. Anytime after that, or I should say December 16th, if you are eligible, found eligible, then your coverage would begin February 1st of 2014. Okay, so that's the important thing to remember. For Medi-Cal, you can apply at any time. There's absolutely no open enrollment period. You can apply now for the expanded Medi-Cal, which starts January 2014, January 1st. You can apply in February, you can apply in June of next year, anytime you want. You can apply for Medi-Cal. And the expanded Medi-Cal coverage doesn't begin until January 1st. So how do we apply? So you can go online. You can go to www.mybenefitscalwin.org, and that's where you can apply for healthcare coverage. You can apply for Medi-Cal, and you can also apply for other programs that we offer. We have CalFresh, which is formerly known as food stamps, you can apply for. We have cash assistance, and you can apply for general assistance. So there are many programs that social services have, but today's forum is really speaking to healthcare coverage, but I just want to let you know that those are things you can apply for in any of these manners through our office. You can send mail-in applications, or you can give us a call at this number, 408-758-3800. Right away, when you call, you'll be able to get transferred to an eligibility worker who will then guide you through the entire process, whether it's for Medi-Cal or if you want to have a health care coverage through Covered California. The in-person, you can walk into any of our offices. We do have many district offices. I just put one up here because I didn't want to bombard the slide with too many offices, but this is our main intake office, and it's the 1867, right on Center Road, right here in San Jose. So you can go there, walk in, or you can call, make an appointment with an eligibility worker. That way, again, they can assist you through the process. The resources, this is just information as far as phone numbers and websites that you can visit for our agency, Covered California, for Medicare, and then the Social Services Agency. Okay? So if you want coverage, healthcare coverage through Covered California, you don't necessarily have to go only through Covered California. You can definitely contact Social Services Agency, and we will guide you through the process. If you're 65 and older and you need to apply for Medicare, you can go through your local Social Security Administration office. When you call them, they'll let you know what office is closest to you, and they can assist you through that process. So that concludes the presentation portion. I'm going to go back and leave this slide up just in case you want to write down some of the information. And I would like to now get to some of the question and answers. So I'm going to read a question here. It says, an individual is below the 138% FPL, which is federal poverty level, and qualifies for Medi-Cal. This individual is also co-owner of his or her parents' house. Will that asset ever have to be repaid to the state? So this question deals around the estate recovery through the state, and a form that you can actually go online, and if you Google it, you'll be able to find it. It's a question and answer regarding estate recovery. It's the DHCS 9059. And DHCS stands for Department of Healthcare Services. So again, the form that you can just go online and look for is D as in dog, H as in Henry, C as in cat, S as in Sam, 9059. And what you're going to see is it'll mention something like this. DHCS cannot make estate claims for reimbursement of benefits properly paid after age 55 until the death of the Medi-Cal recipient. The state only initiates claims against the estate of deceased Medi-Cal recipients. The state's claim includes, but is not limited to, the following healthcare services paid on behalf of the deceased Medi-Cal recipient: nursing facility services, home and community-based services, related hospital and prescription drug services, health insurance premiums, including Medicare Part A and B, and Delta dental premiums. The next question, if an individual has Medi-Cal and then applies for Kaiser or Blue Shield, but he or she is told that they cannot take him or her, what does he or she do? So when you apply for Medi-Cal, and if you're found eligible for Medi-Cal, you have two managed care plans that you can choose from. Those managed care plans are Santa Clara Family Health Plan and then Anthem Blue Cross. Those are the only two that are available if you're eligible for Medi-Cal, which includes the expanded, which starts January. So this doesn't mean if you wanted to go privately and purchase Kaiser, or purchase, I should say, a health plan through Kaiser, that you're not allowed to do that. You can still do that. It would be considered other health coverage. But if you're found eligible for Medi-Cal and have a zero share cost, that's a decision that you would have to make on your own. But as far as the two plans that are available for Medi-Cal recipients, those are the two, Santa Clara Family Health Plan and Blue Cross. The third question, an individual who is 65 years old or older has Medicare and Kaisers Senior Advantage. His or her co-payments are raised next year, which could be hard for him or her to pay. Considering the individual needs many continuous lab tests, can he or she apply for help from the government to cover some of these costs? So you can apply for an individual who's currently on Medicare. You can apply for Medi-Cal. We do have, for example, our A&D FPL program, which is Aged and Disabled Federal Poverty Level program. And it's possible, if you're eligible for that program, you would have a zero share cost. So if you have Medicare, your Medicare would be the 80% that it covers, and then the Medi-Cal would cover the 20%. If you're not found eligible, or you are, you can still also look into, as far as Medicare, these are Medicare recipients. There is the QMB, which is the Qualified Medicare Beneficiary Program. And what that program does is it pays the premiums for Medicare Part A. The premiums only. It does not cover deductibles or co-payments or co-insurances. There's also the Specified Low-Income Medicare Beneficiary Program, and that one covers the Medicare Part B premium. However, you can't have both. You cannot have the QMB and the SLMB at the same time. The next question is, an individual has Medicare and other coverage for the gap in prescriptions for many years. He or she is pleased with this coverage and doesn't want to change anything. He or she intends to keep this coverage for many more years. Will there be a problem with the government-backed health programs if the individual wants to continue with their current coverage? So individuals who have Medicare are not eligible for health care coverage through Covered California. The Medicare meets what they call the minimum essential coverage. So if you're already eligible and receiving, better yet, if you're eligible or entitled to receive Medicare, you are not eligible to apply. I shouldn't say apply, you can apply, but you wouldn't be eligible for healthcare coverage through Covered California. The other programs that kind of fall along that same line is TRICARE, which is offered through the Department of Defense. There's also certain veterans coverages. Medi-Cal is another one. If you're eligible for Medi-Cal, you cannot apply for healthcare coverage through Covered California. Okay? If you're receiving coverage through your employer, so employer-sponsored health coverages, also you wouldn't be eligible to receive a health plan through Covered California. And the last question I have here is, under what conditions could a person with employer-sponsored health insurance apply for Covered California? So this is going to be like that caveat to what I just said, because I said employer-sponsored coverage, if you have it, then you're not able to receive healthcare coverage through Covered California. So the slight caveat to that is, what's mentioned is, if your modified adjusted gross income is over the 9.5% affordability rule for the person. So you as an individual, you're working and they're offering you insurance through your job. That insurance is over, your income is over that 9.5% of what they call affordability. So if that is the case, then you would be eligible. You don't have to take the insurance through your employer. You can apply for insurance through Covered California. Okay. Well, the thing to remember again here is it's to the individual, the person who's actually working and receiving coverage through their job, or being offered coverage through their job. If their modified gross income, adjusted gross income, is over, then you would be eligible. But if it's under, then unfortunately the employer-sponsored health coverage is considered affordable to that individual and their family. So they would not be eligible to the advanced premium tax credit, known as APTC, through Covered California. Covered California does have unsubsidized healthcare coverage, so that's something that you could apply for. But if you're looking for subsidized, which is the advanced premium tax credit. And really what that is you're able to receive a tax credit ahead of time that you can apply to your monthly premium payment, and you can bring it down, okay, each month. Or you can choose to wait till when you file your taxes at the end of the year, the end of the tax year, I should say, and then you can receive the premium tax credit during that time. Okay, so I know I think I'm very close here on time. I think I have maybe 40-something seconds left. So, I'm sorry? Okay, so I did want to thank everyone for coming out today. I really do appreciate it. I think, Juan Estrada, what you're doing is great. I appreciate you contacting our office and our agency, because healthcare reform, the Affordable Care Act, or Obamacare, as some individuals may know it, is something that's really new to everyone. And everyone is trying to understand what they need to do for their own families and for their own household. So it's something, coming to this is a big step, because you're getting informed, you're getting educated about it, and you can share it with the rest of your community and your families. Social Services Agency is available to assist you with that process. If English is your second language, we have individuals who are bilingual, trilingual, quadrilingual. Any language you speak, we are able to assist you in. It doesn't matter what it is. So the only thing you need to do is just come down to our office, give us a call, or you can go to the website to apply, and you still may get contacted through that direction anyway by an eligibility worker, and they can assist you through the entire process of receiving healthcare coverage through Cover California or for Medi-Cal. So I want to thank everyone again for your time, and thank you for listening.
Hi, my name is Rachel Richardson. I'm with the Mental Health Advocacy Project, and I just wanted to let people know about a new project we're doing to do with mental health parity, which is making sure that insurance companies pay for mental health and substance abuse benefits just the same way they do for medical and surgical benefits. So if you know of someone who's having a problem with their coverage for mental health or substance abuse treatment, you can send them to Mental Health Advocacy Project, and I have flyers and business cards. The phone number to call is 408-280-2407.